Hello everyone. Today we will be discussing on appetite. Desire to eat food. The body will automatically generate the desire. That is possible when a healthy body is there, when you are healthy. Whenever your body is deficit, so that is hunger. There's a difference between appetite and hunger. Appetite is itcha, which is automatically generated inside the body, and hunger is it is also the response of the body whenever the body is deficit, or whenever the body feels after a long duration of time you have not taken any food. So the requirement of the body will be asking for, or it will be demanding that you to have food. So the hunger is the symptomatic expression by the body whenever the food deficit is there in the body. And appetite is something which is automatically it will be generated in the body. Appetite cannot be induced. Hunger can be induced, because if you have appetite, if you're talking about a good health, the appetite is must. And when you take food, when you eat healthy food, the food of your choice, that will not only suffice your taste bud, that will be giving you feeling of complacency, satisfaction. That will get converted in good health. What are the indications and what are the signs and symptoms we will be feeling, and we can feel that the patient or individual's appetite is low? Number one, he'll be not wanting to have food. No desire. Second, whenever he get idea of food, whenever he think about having food, he'll get nausea feeling, vomiting sensation. So these problems, these signs and symptoms indicates anorexia. Anorexia is the loss of appetite or decrease of appetite. What we do, what are the steps we have to follow, and what we take care in order to lift or improve this appetite? That normal practice, healthy practice is advisable. So before we go for improving the appetite, let's understand what are the reasons the patient or individual is feeling or complaining of decrease of appetite, or appetite is not there, or anorexia. Number one, bacterial or viral infection. There is some infection in the body whereby the patient is not getting good appetite. Number two, gastrointestinal problem. Number three, colitis. Number four, psychological cause like anxiety, stress. Next reason can be the eating disorder. Next problem can be chronic liver disease, and the next reason for this can be kidney failure, heart failure type of conditions. Next point will be cancer. In few cases of cancer, wherein the colon cancer, stomach cancer, pancreas cancer, decrease of appetite or anorexia symptoms are there. So next reason can be due to some medication, some supplements. Now let's try and understand what are the other side of that. One, we are talking about anorexia. Whenever the patient is complaining, or he may be having some of the other symptom where appetite is more, when he demands or he prefers more intake of food, that also shows some disease. Broadly or predominantly, when we talk about a diabetic patient, will be showing more symptoms wherein polyphagic, he'll be having number of times he'll be preferring and he'll be asking for something to eat. And increased appetite is another indication of there is some malfunctioning or improper functioning of the endocrine gland is there. If endocrine system is not working properly, that will lead to increase in appetite. So both the parameters, increase in appetite or decrease in appetite, is not good for health. We understood and we discussed about the causes of decrease in appetite and causes for increase in appetite. Let's try and understand what are the methods, what are the steps we can follow in order to normalize our appetite. Yes, it is primarily focused on the patients or the person who have decreased in appetite, and those who are having increase in appetite, for them also there will be a separate or different mode of approach for reducing their appetite. So when we talk about a person who is suffering from decrease in appetite, what are the methods he can take in order to normalize or bring his appetite back to the normal condition? Number one, he need to get his health examination, proper health examination, analysis of his problem have to be done by doctor, because we need to know the cause for your decrease in appetite. Merely if you complain, that will not be sufficient for starting the treatment. Either it is due to some infection, either it is due to some other internal body organ problems, or due to some chronic health issue that is prolonging and hiding inside your body, which is not expressing symptoms. So those parameters have to be addressed. For that, assessment, diagnosis, and analysis of your health have to be performed. Number two, what we can do is navel alignment. I discussed in one of my live discussions also, one of my health topic, about the importance of navel alignment. It plays very important role. If your system is not working on the natural rhythm on its own, it need to be addressed. You cannot expect the normal functioning of the body. So navel alignment have to be looked into it. Before you take navel alignment, it is advised you should take body detox. Detox your intestine, detox your digestive system. Fourth point is regular healthy diet should be practiced. Fifth point is regular physical activity, yoga, breathing exercises have to be done as a routine practice. Next method what we can follow is we can plan a systematic juice therapy in order to revive your appetite, in order to revive the symptoms, organs to function of its own natural activity and the metabolism of your body. The juice therapy, systematically juice therapy, if you take, that will be highly beneficial. Next method what we can follow is we need to understand and follow magnet therapy. Magnet therapy is very effective. If the system is lethargic, if the system is not working at to the extreme, to the maximum possible level as per the requirement, that need to be agitated, that need to be excited, that is possible through discussing and getting a proper care from magnet therapy. Next method, what we can talk about and what we can practice for getting this revival is through coming in sync with nature. Merely taking the disease, merely taking the treatment, medication, and other things will not serve the purpose. We need to understand it should be a systematic, consistent, easily acceptable methods which body is compatible in adjusting. So those methods have to be practiced by individual under the observation and guidance of experienced doctor. That will be giving you not only the result, that will be giving you the complete solution to your problem. And if you follow those type of things, those type of practices, you can expect the reversal of your problem is possible. Thank you very much. Take care of yourself.